Hi everyone, this is Scott Reeves. This is FSN 329. We're going to continue on with the vitamin C lecture. And we went through almost all of this. We just have a few minutes left. And we should have ended up at, I believe, the stability slide. So the next slide is about vitamin C intake, and this is a continuum. If you look down the left side of this, it shows the high level of vitamin C intake up here where we have 3,000. This is milligrams. Let's look at this first. Remember, the RDA for vitamin C for women is about 75 milligrams a day, and for men it's 90 milligrams a day. So with that context, let's look at this. This shows all the way up to 3,000 milligrams a day. We can see that there is a UL for vitamin C at 2,000 milligrams a day, which of course is 2 grams. And then down here all the way to the bottom we have a zero intake. And this shows down at the bottom that it only takes about 10 milligrams a day to prevent scurvy. And 30 milligrams a day can actually support metabolism. So you would have enough to perform most of the metabolic functions for vitamin C. Up here, the RDA, this is a little bit hard to read. You can see where it shows 75 milligrams a day for women, 90 for men. And then you can see the next level is about at 100 milligrams a day, the tissues are saturated, which means if you consume more than that, the tissues already have enough vitamin C, so basically it's going to be excreted in the urine. The next level that's shown here is where it shows recommendation for women smokers and then the recommendation for men smokers. One of the things that I mentioned last time as a source of free radicals and oxidants is smoking. So smoking significantly increases the amount of oxidants or free radicals in the body. It also significantly increases the vitamin C requirements because it can increase the breakdown of vitamin C. The smoking can. So it's recommended that smokers have an additional 35 milligrams a day. So there is a significant relationship between vitamin C intake and whether or not a person smokes. If we look up at the top, well, let's see, a little bit higher, we have limited absorption and little increase in blood concentration at higher doses. That's at 200 milligrams a day. So about 2 to 3 times the RDA. You're really not going to absorb much of that. 2,000 milligrams a day is the UL. So even though we hear a lot of people taking vitamin C and we think of vitamin C as a water-soluble vitamin that's probably not harmful in high amounts, I think that's what a lot of people think. There is a UL for vitamin C. And one of the main reasons for the UL, the most common problems are in the GI. There's abdominal pain and osmotic diarrhea that can result because when levels are taken that are that high, a lot of the vitamin C is not absorbed in the small intestine, goes into the large intestine, and the bacteria in the large intestine metabolize it and make smaller molecules that actually attract water into the large intestine, and that's what can cause some of the complications. So that's the main reason there's a UL. So let's look at the absorption mechanism and also its efficiency. So you can see there's the enterocyte shown there. Each one of these rectangles is supposed to represent a protein transporter. The AA is ascorbic acid. The DHAA is for dehydroascorbic acid. So the reduced active form of vitamin C and then the oxidized form of vitamin C. Now both of these can be in the gut, so we can actually consume some of the oxidized form, the DHAA, and actually absorb it. So that can be present in our gut because it was present in the food, and also sometimes it is oxidized in the gut. But remember, it can be reduced back to its active form. Let's look at this. The ascorbic acid is transported into enterocytes by what's called SVCT, which stands for sodium dependent vitamin C transporter, and it is as its name implies, it's sodium dependent, so it is energy dependent. And there are at least two of these. There's SVCT1 and there's SVCT2. They are highly efficient transporters. It's active transport, but because of that, they are saturable. Now that can kind of help protect us from absorbing too much vitamin C if there's a lot of vitamin C in the gut. So one way that people can overwhelm the system and still absorb high amounts of vitamin C is they'll take it in several doses over the day, and that'll do that. That'll increase the absorption efficiency of SVCT1, because if you're taking that in consistently and that transporter is always working, then you can absorb quite a bit. Also, when it's at really high amounts, some of it actually does diffuse in. So absorption efficiency goes down as we consume more. So for example, at average absorption efficiency or intake levels at about 30 to 180 milligrams a day, absorption efficiency is about 70 to 95%. So I would say, at appropriate or moderate intake levels of vitamin C, absorption efficiency is about 80%. That's what's considered for the recommendation of intake. So the DRI assumes we absorb vitamin C at about 80%. Now, if you take in lower amounts than that, let's say lower than 20 milligrams, it actually can go up to about 98% absorption efficiency. But contrary to that, if you take in significant amounts, about 12 grams, for example, absorption efficiency goes down to 16%. Okay, now DHAA, and this shows that, see GLUT, and that stands for the glucose transporter. Remember, we have GLUTs on the enterocyte brush border membrane, and these lines through here show that the GLUTs do not absorb ascorbic acid, but they do absorb and transport DHAA into enterocytes. If DHAA is present anywhere else, like in the plasma, GLUTs can also transport that DHAA into cells throughout the body. So that's the way that DHAA actually gets into cells, and that's a fairly efficient mechanism for that. And then once the DHAA goes in, it can be reduced to vitamin C. So that's also a source of vitamin C in the diet. Interestingly enough, there's also a specific DHAA transporter on the enterocyte membrane. So DHAA goes into enterocytes pretty efficiently. I don't think they know a lot about this transporter, but they know that it is specific to DHAA as well. Okay, so we have a variety of absorption mechanisms. Now, we mentioned this before, but we're talking about vitamin C in the common cold before, so let's talk a little bit more detail about this. One of the individuals I mentioned was Linus Pauling, and Linus Pauling wrote a book in 1970, and it was called Vitamin C and the Common Cold. And he said that 1,000 milligrams a day would decrease the incidence of the common cold by 45%. And he said that would occur in most people, but some people would actually need more than 1,000 milligrams a day. And he said our intake should be what other animals produce by themselves. And so if you take the production rate of other animals and you calculate how much they produce per body weight, and you multiply that out by our body weight, that equals about 10 to 12 grams of vitamin C a day. That's what he said humans should consume. Or he said that would be a reasonable biologically justified amount. And he actually got his intake up to 18 grams a day. Remember, the UL is 2 grams a day. I think he actually, at that point, you're going to have some complications. And but he was adamant about this, and especially later in his life when he was, I think Linus Pauling lived to be in his early 90s. He actually lived in Cambria for a while when he was retired. Brilliant physicist, brilliant individual, absolutely passionate about vitamin C. I remember when I was an undergrad, I was working for a professor here, and I was doing grading for her, and one day she got a phone call from Linus Pauling, and I talked to her after she got off the phone, and she was kind of upset, and she said, that was Linus Pauling, and I didn't know who he was. And she said that he was extremely upset with her because she had done an interview on the local news the day before talking about how a lot of vitamin C wouldn't be beneficial and it could actually be harmful. So he had seen the interview and called her and told her, you know, why she was wrong. She said, I was kind of upsetting because I know he's won a couple Nobel Prizes. So he was passionate about this, and I think that one thing that to bear in mind is, I mean, subsequent studies, so other scientific studies have basically shown that this is probably not an appropriate level and that it wouldn't benefit individuals. What's one reason why high amounts may not be effective in decreasing the incidence of the common cold? Well, one thing is a lot of that vitamin C isn't absorbed. Remember, it just ends up in the large intestine and it can cause problems. I mean, essentially, you want enough vitamin C to saturate tissues, and you don't need gram amounts in order to do that. So, lots of studies have shown that, and we talked about placebo and everything, and who could benefit from increased levels of intake? Well, again, those individuals that may not be consuming adequate amounts of vitamin C in the first place. You know, vitamin C has really important roles, but once we saturate those tissues, then that should be maximizing vitamin C function in the body. So how do we assess vitamin C status? Well, there's a few different ways. Most common ways are plasma and serum vitamin C levels. It's often used for assessment if plasma concentration is below 0.2 mg per deciliter, and individuals considered to be deficient. Plasma concentrations associated with tissue saturation are about 1 mg per deciliter. Recommended intakes, the RDA usually results in plasma concentrations between 0.6 to 0.8 mg per deciliter. So near saturation, but not completely to saturation, are associated with RDA amounts. So that's the way we're going to say that vitamin C is assessed. White blood cell vitamin C levels can also be done, and this better reflects vitamin C status, but the assay is technically difficult to perform. Sometimes those plasma and serum levels of vitamin C don't absolutely reflect tissue levels for the rest of the body. So that's one thing to consider, but most of the time that's considered to be adequate and appropriate method of assessment. So I think that wraps up vitamin C, so pretty quick. Hopefully this was clear, and I'll end it right here.